3 million cases of dementia are diagnosed each year. It's characterized by a decline in memory and often a symptom of other illnesses. Joining us today to talk about dementia and how to optimize your brain health is neurologist and movement disorder specialist, Dr. Deborah Boland of Be Mobile Neurology. Welcome, Dr. Boland.
Thank you for having me.
Thank you for joining us on an issue that I think we're going to continue to hear a lot about because, as we said, 3 million cases a year. Our aging population is living longer and, having to deal with dementia. So what does dementia mean clinically?
So dementia is a description, and it means somebody's having cognitive problems, and that includes things like short-term memory, long-term memory, attention, executive function, judgment, and then that can be displayed, those problems, as behavioral problems and issues as well.
Okay, so are they things that we can avoid, or as we get older, is this just a symptom of our brain aging?
So no, there's definitely pathology related to it. Dementia is a big category, and then Alzheimer's is one of the types of dementia. So that has genetic and environmental causes. So we can absolutely do things to enhance our brain health and optimize that function, but not all of it's preventable.
Okay, so if we do sort of classify someone as dementia and we kind of create that, is that a diagnosis on its own?
It is not a diagnosis on its own. So the physician you're working with should seek the etiology or the cause of the dementia and what's causing the cognitive impairment, because there's lots of causes. There's even a category of what we call pseudo-dementia. One of the biggest causes is depression and mental health issues or a thyroid problem.
Interesting.
So you really have to do adequate research with your physician to figure out what's going on.
Okay, so if we've done that and we know that dementia is a part of a bigger issue, how do we then treat that? Can we make it better?
Yes, each one is treated individually. But what we do know is that whatever the cause of the dementia, doing things like exercise is absolutely helpful. I actually just came from a lecture talking to some healthcare providers on how exercise actually changes the genetics cellular level of things. So it's very exciting, some new research that's coming out in that area. Things like sleep, things like treating even mild depression, your diet, nutrition, being involved in your community and having socialization. So all of those kinds of things will enhance your brain health and enhance the problems that are going on.
So we've just seen some sort of pictures there of you going and working with patients. How do you work with your patients to help sort of treat dementia, if you will?
So I have a very unique practice. I am a mobile neurologist, so I go to their home. So that's what makes it so unique, is I see them in their own environment, and we are able to deal with the challenges that they may face on a day-to-day basis in a real-world time.
Okay, wow. And do you find that being in their own environment sort of makes them more comfortable? Because I know I have family members that had Alzheimer's, and my husband's family has it as well. And sometimes it becomes very scary. They feel like they're not the person they were before, and they almost shut down before their brain shuts down.
Absolutely, and we would see that all the time in the clinic, and that was one of the reasons why I started the kind of practice I have.
Okay, so if I have a family member that I see problems, they're aging, what can I do without overstepping boundaries and making them uncomfortable?
That's the tricky million-dollar
it's
question.
Like addiction in a way, trying to approach this, like we need to talk about it, but we don't want to make it too big of a thing.
Right. So you would hope that their primary care doctor is clued into that. And every Medicare patient is eligible for a cognitive exam yearly, just like some of the other things you're eligible for yearly. So you hope they're doing that. And if they're seeing any kind of little red flags, then they would clue into finding the causes and reasons. And then to just really talk openly with family about dementia and how common is it, and just really being open lines of communication.
For people at any age, I know we talked about exercise things, but for me, I'm, not that old yet, but I know that I do have a family history. Should I be doing those same things the older patients are doing to prevent dementia?
Yes, absolutely. So living that healthy, well-balanced lifestyle, focusing on exercise, nutrition, sleep, all of those kinds of things.
Do you think we will in the future? I know a lot of funding and research is going into Alzheimer's particularly. Do you think we will be able to find a cure?
Yes, I think in my lifetime for sure, hopefully my career.
Good. Well, I'm very happy to hear you say that. And we also really appreciate your advice and what you're doing to help people with this issue in the Tampa Bay area. And if you would like more information on optimizing your brain health, you can visit Dr. Boland's website at bemobileneurology.com. Thank you for joining us.
Thank you so much for having me.
Very insightful. Guys, stay tuned. We'll be right back with more Bloom.